Hi, my name's Pip and I work at Sydney Advanced Physiotherapy in Linfield. We're going to talk a little bit about cesarean scars because it's not something that many women get much information about when they leave hospital. Now, any scar needs to be managed. Otherwise, they can become lumpy, they can adhere to the tissue underneath, and they can create a weak patch in the muscle where there's no give and no slide when that muscle tries to activate. Cesarean scars can create lots of other problems, so if there is a little bit of adherence to the tissue underneath, you can get tension in the nervous system and tension in the muscles. This commonly creates things like knee pain and itching around your anal sphincter. Because the scar is so close to some of your internal organs, you can actually also get adherence onto the organs themselves, particularly onto the bladder. Now, this can create issues with your bladder function and you can get symptoms like urinary urgency, which means that you feel like you need to go to the toilet right now and you can't delay and go in 5 minutes or 10 minutes time. The other thing that happens with a cesarean scar is that it can affect the way your core turns on. Because they've actually cut through the muscles to get the baby out, if you don't retrain the way these muscles work, this can also affect your continence because your core muscles attach directly around the neck of your bladder and help pull it up to stop the flow of urine. If your core is not activating properly, you won't get this suspension lift on your bladder. The other thing that won't happen is then your core won't support your back, so it leaves you a little bit prone to back pain, which obviously when you're carrying a small child is not ideal. So one of the things that physios will teach you to do is how to properly manage your scar. So they will teach you how to desensitize the area and how to massage the scar so that it's as minimally lumpy and nice and flat as possible. Physios can also show you special products that you can actually put on the scar to help it heal a little bit faster. So just remember that if you've had a cesarean, it's really important that you come in and see one of our physios, that you learn how to turn your core on again properly, and that you manage that scar so that the effect of the cesarean is as minimal as possible. If you need any help or you have any questions, please give us a call on 9416 4410 or comment below and we'll get back to you.